Gabapentin Early-Onset Dementia Lawsuit. Disclaimer: this video is for educational purposes only. It is not medical advice or legal advice. Watching this video or contacting our office does not create an attorney-client relationship. Every case is different. What is gabapentin and who is it prescribed to? Gabapentin is a prescription medication used to treat certain seizure disorders and nerve pain. It is sold under the brand name Neurontin and is also available in generic form. Doctors also prescribe gabapentin for some conditions that are not specifically listed on the drug's FDA-approved label. This is known as off-label prescribing, and it is legal and common. Gabapentin has been used by millions of people. Gabapentin and cognitive injuries. Now, new research is raising questions about whether repeated or long-term gabapentin use may be associated with memory problems, mild cognitive impairment, and dementia, especially when these conditions develop in younger adults. Because of these concerns, lawyers are investigating potential claims on behalf of people who developed early-onset dementia or other serious cognitive problems after using gabapentin. Zoll Kranz is currently reviewing potential cases nationwide. If you or a loved one took gabapentin and was later diagnosed with early-onset dementia or mild cognitive impairment, visit toledolaw.com or call Zoll Kranz at 419-827-3194 for a free case evaluation about the Gabapentin lawsuit. So, what is this emerging litigation about? The legal claims generally focus on what drug manufacturers knew, or should have known, about possible long-term cognitive risks associated with gabapentin. Potential plaintiffs may allege that manufacturers did not adequately investigate those risks or warn patients and healthcare providers about a possible association with dementia, memory loss, or cognitive decline. These are allegations. The litigation is still developing, and courts have not made a final determination that gabapentin causes dementia or that any manufacturer is legally responsible for a particular person's condition. Research connecting gabapentin to alleged injuries. The recent concern is based in part on a 2025 study published in the medical journal Regional Anesthesia and Pain Medicine. Researchers reviewed healthcare data involving adults with chronic low back pain. After matching patients with similar characteristics, they compared people who received gabapentin prescriptions with people who did not. The study reported that patients who received 6 or more gabapentin prescriptions had a 29% higher rate of dementia diagnosis and an 85% higher rate of mild cognitive impairment than comparable patients who were not prescribed gabapentin. The researchers also reported stronger associations among adults under age 65. This has drawn particular attention because dementia diagnosed before age 65 is commonly described as early-onset dementia. But this point is extremely important. The study was observational. It found an association, which means two things appeared together in the data. It did not prove that gabapentin directly caused dementia. Other health conditions, medications, or risk factors may also affect a person's cognitive health. More research is needed. What are dementia and mild cognitive impairment? Dementia is a broad term for serious problems with memory, reasoning, judgment, language, or other thinking abilities that interfere with daily life. It is not a single disease, and it can have many possible causes. Mild cognitive impairment, often called MCI, involves noticeable changes in memory or thinking that are greater than normal age-related changes. A person with MCI may still live independently, but they or their family may notice repeated problems. Possible warning signs can include forgetting recent conversations or appointments, repeating questions, having trouble finding words, losing focus, struggling with familiar tasks, making unusual decisions, or needing more help managing medications, finances, or daily responsibilities. Memory problems alone do not necessarily mean that someone has dementia. Sleep problems, depression, other medications, stroke, metabolic conditions, and many other issues can affect memory and concentration. A qualified healthcare provider must evaluate these symptoms and determine the diagnosis. If you currently take gabapentin, do not stop taking it on your own. The FDA-approved prescribing information warns that abruptly or rapidly stopping gabapentin can increase the risk of seizures and other adverse reactions. Speak with your prescribing healthcare provider about any memory problems, confusion, or other new symptoms and follow their medical guidance. Who may be considered for a potential legal claim? Each case requires an individual review. Current screening may focus on factors such as the number and timing of gabapentin prescriptions, the reason the medication was prescribed, the person's age when cognitive symptoms began, and whether a doctor diagnosed early-onset dementia or mild cognitive impairment. Attorneys may also examine other possible causes or risk factors, including a history of traumatic brain injury, stroke, neurological disease, certain psychiatric conditions, or known genetic factors associated with dementia. Meeting one factor does not automatically mean that a person qualifies for a lawsuit. It also does not prove that gabapentin caused the diagnosis. An attorney must review the complete medical and prescription history before deciding whether a claim can be investigated. Evidence for a gabapentin dementia claim. Helpful records may include pharmacy records showing when gabapentin was prescribed, medical records documenting cognitive symptoms and diagnoses, cognitive testing, neurological evaluations, brain imaging, records of related medical expenses, information from family members or caregivers about changes in daily functioning. First steps: signing up for the lawsuit. You do not need to understand the entire legal process before asking for help. During a free case evaluation, our team can ask questions about the medication, the diagnosis, and the timeline. If the potential claim meets the current screening criteria, the next step may involve collecting and reviewing records in greater detail. These claims are generally evaluated individually. This is not currently a certified class action for gabapentin-related dementia. The facts, deadlines, and legal requirements can also vary by state. Because filing deadlines may apply, it is important to speak with a lawyer promptly if you believe you or a loved one may have a claim. Contact Zoll Kranz. Zoll Kranz is investigating potential gabapentin dementia claims and is accepting clients nationwide. If you or someone you care for used gabapentin and was later diagnosed with early-onset dementia, mild cognitive impairment, or another serious cognitive condition, visit ToledoLaw.com or call 419-8273-194 for a free case evaluation. There are no upfront costs, and for qualifying cases, you pay no attorney fee unless we recover compensation for you. Again, this video is provided for educational purposes only and is not medical or legal advice. Viewing this video or contacting our office does not create an attorney-client relationship. Do not stop or change any prescribed medication without first speaking with your healthcare provider.